Well, welcome to UVM Extension's Building Capacity webinar series. This series is just one part of a larger learning project to help you build capacity for leadership within your organization, as well as more effectively achieve the mission of your organization. The education and training provided in the Building Capacity project is delivered in a variety of forms, covering 10 topics: board development, conflict management, developing volunteers, ethical leadership, leading through change, quality service, staff development and evaluation, strategic planning, team leadership, and working in teams. Today, the topic of our discussion is leading through change. Your microphones are muted, and we welcome your questions and comments through the chat box, and that is the white area at the very bottom of your screen on the left-hand side. And so if you have a question, please feel free to type it in that chat box, and our speaker, Karen, will address those a little later in the program. You will also find a set of icons just below the participant listing right there where you found that green check mark, and we will be using these to engage your participation in the webinar. Currently you see the check mark there, and when polling questions are used, the choices may change for your response, but they will be right in that same area. Would you please enter your email into the chat box so we have a better idea of who's joining us today? The session is being recorded and will be available from downloading from our website. We'll be like to have some idea of how many participants are with us today for the webinar. So if you could answer this question for us, this polling question, and Lucy will make magic so that we have some options up there for you to choose from, but how many individuals are participating with you at your site? Would you respond by selecting the letter that corresponds to the number of individuals that you might have gathered with you for the webinar today? Okay. So without further ado, I'll turn the mic over to our presenter, Karen Geraghty, and her topic for today is navigating Vermont's new healthcare coverage.
Thank you, Ellen, and I just wanted to acknowledge your help, Ellen, as well as Roberta Ripatella of the Kansas State University Research and Extension for her help with materials used in this presentation, as well as Lucy Carrasco for providing the web magic that we have before us. So today's topic is Vermont's healthcare and the insurance exchange market. I'm just going through my papers here, but the insurance exchange market that has actually opened today, October the 1st. And before we get into this, I just put out a disclaimer statement that this presentation is meant to be educational and that it's an appropriate role for UVM Extension to provide this information to help our Vermont residents make informed choices. And all the information as of this morning is factually correct. And you can get more educational resources on public policies such as the Affordable Care Act at resources I'll give you at the end of the presentation. So thank you very much, and we'll now continue into the presentation. So the outline of today's talk, I'm going to do a brief overview of the U.S. healthcare situation. Why the Patient Protection and Affordable Care Act was passed 4 years ago. As a result, there was the creation of the Health Insurance Exchange, which we've heard so much about, and specifically for Vermont, the Vermont Health Connect. And then at the end of the presentation, we'll take questions regarding the presentation. U.S. healthcare is helpful. It's helpful to understand U.S. healthcare that's driven by concerns with three elements: the cost of healthcare, the quality of healthcare, and the access of healthcare. Why do we need in the U.S. healthcare reform? Due to cost, quality, and access. We know that our costs are excessive. Our quality of healthcare across the country is inconsistent. There are health disparities, and patients often don't receive the recommended care. Access is inadequate. There are millions of people across the country who are underinsured or uninsured, or they're one major illness away from being uninsured. There are also difficulties with access, particularly in more rural regions, with having the right healthcare provider close by. I just want to take a look at the question of cost. This is based on the 2010 analysis of the distribution of national health expenditures by type of service. This is in billions of dollars. And you can see that the national health expenditure is $2,593.6 billion. It gives you a sense of the breakdown, the hospital care, other healthcare spending, which includes dental and professional health services such as medical equipment, other personal health care, prescription drugs is a big one, nursing care facilities, and of course physician, clinical services. U.S. health expenditures per capita over the last 50 years have risen exponentially. Per person, the cost was $147 in 1960. In 2010, that number is $8,402 per person. What accounts for these costs? Well, as we know, over the last 50 years, there's been a tremendous influx of technology and development of pharmaceuticals in healthcare. And these have combined with the way in which our healthcare is structured to increase costs and not put a cap on the way in which healthcare is financed. I want to show from workers' earnings what the workers' contributions to premiums are with regard to inflation and workers' earnings. So you can see that just over the last 10 to 12 years, there's been an exponential increase in health insurance premiums, as well as the worker contribution to these premiums. So the second level of concern are the concerns about quality of healthcare. So we've looked at the costs and seen the tremendous increase in cost. But of course, healthcare is not just about cost. It's about the quality of healthcare that we receive. We know that much illness is preventable. It's estimated that 40 to 70% of premature deaths are preventable, and a third of acute disability is preventable. 2/3 of chronic illness and disability is also preventable. Our U.S. system is biased toward too little preventative care and too much treatment. There are questions about the appropriateness of some medical treatments. And we know from statistics that the USA does not rank as high as it should on our basic health status measures, particularly given the amount of capital investment that we put into healthcare. There are also concerns in this sort of tripartite approach to healthcare about concerns about access. There's a lack of insurance or matching insurance to providers because not all providers accept all types of insurance. There's a shortage of providers in some areas. If you live in the inner city or if you live in rural places, you may actually face the same issue of not having healthcare providers locally situated. And of course, there's an issue of distance, which we consider more than 30 minutes. And of course, there are predictions of the shortage of providers due to changing demographics. So all of these factors impact what we understand to be access. Access also includes an individual's ability to pay for healthcare. Now you can pay either out of pocket, which is essentially a fee-for-service type of model, or you can pay by insurance. But healthcare is not like other commodities. You can't just go into a store and buy healthcare. We say that healthcare is a basic human need. You never know exactly when you're going to need critical healthcare. But the purchase price of healthcare is unpredictable. Excuse me, when you go into a physician's office or a clinical care center, you don't exactly know what you're going to be paying for the service that you're going to get. So it's essentially an unknown purchase. Most people rely on health insurance to mediate these costs. Now there are two types of insurance programs. We have the public sector, which are government programs, and we have the private sector, which are individual insurance programs and employee programs. In the employer scenario, these are fringe benefits rather than salary, and they're non-taxable benefits. That's effectively a $75 billion subsidy to corporations and individuals. So in the public sector, we have things like Medicare to care for the elderly, Medicare to pay for people who have certain income sensitivities. We have state children health insurance programs. There are programs through the Veterans Administration, the Indian Health Service, and workers' compensation. In the private health insurance market, we rely on individual and small group health insurance plans, as well as large employer group plans. So as you can see, our healthcare is a rather complicated structure. Those who don't have healthcare at the moment are uninsured, and there are several facts about uninsured individuals. Most of the nation's 47.9 million people who are uninsured have low or moderate incomes. More than 3/4 are in a working family. Medicaid and the children's health plans provide a key source of coverage for many who lack access to affordable coverage. About 25% of uninsured adults go without needed care due to cost, compared to 4% of those who need care who have private insurance. And medical bills are a tremendous burden for the uninsured and frequently leave them with debt. There's also hidden costs of being uninsured. The risk of premature death among uninsured Americans is 25% higher than among Americans with health insurance. And an estimated 18,000 Americans die each year as a result of being uninsured. Communities suffer from uninsured individuals because they have more difficulty recruiting and retaining physicians. Hospitals in areas with fewer insured individuals have less trauma and burn care units, with more emergency room crowding and diversion to other resources. And those patients in these areas who are insured have lower quality, access, and satisfaction. So how do we respond to these issues of cost, quality, and access to health care? Based on research as well as our political process, the Patient Protection and Affordable Care Act was created and put into law 4 years ago. It has two entwined reform goals. The first is to make better health insurance coverage more available and affordable for legal U.S. residents. So that goes to the access. It also wants to reform healthcare delivery and financing to provide better quality and outcomes and more cost-effective care. So one of the things that the Affordable Care Act is looking to do is eliminate, for example, duplicate services. Those tend to run costs very high. The comprehensive changes to healthcare insurance and delivery systems will happen in these ways. There will be changes in rules and funding for health insurance, which will try to decrease the number of uninsured individuals. Hold insurance companies accountable, will guarantee more choice to individuals, and offer more affordable insurance. This includes incentives for preventative and wellness programs. You'll recall the earlier slide about a lot of illness and disability being preventable. The Affordable Care Act provides incentives to promote this preventive approach. It provides money to improve access to providers. It lowers the health care costs for the system, in part by eliminating duplicate services. And it affects all population groups and communities. So it pulls a larger number of individuals into the pool of the insured so that it spreads the cost of health care across a greater number of individuals. There are consumer protection facets built into the Affordable Care Act as well. Because of the Affordable Care Act, it is now illegal for insurance companies to deny coverage to children because of pre-existing conditions like asthma or diabetes. It's illegal for insurance companies to put a lifetime cap on how much care they will pay if you get sick. And insurance companies can no longer cancel your coverage when you get sick if they find a mistake on your paperwork. The law makes health insurance more affordable, and in many cases you can get preventive services for free. These services are such like cancer screening, such as mammograms and colonoscopies, vaccinations, blood pressure screening, cholesterol screening, tobacco cessation counseling and interventions, birth control, depression screening, and more. You can go to the healthcare.gov/prevention for a full list of preventive services that are offered for free under the Affordable Care Plan. So what is this Affordable Care Act and the mandate that's coming the 1st of January 2014? Most individuals, as we said, part of the way this plan works is to pull a greater number of individuals into the health care insurance pool and to provide coverage for those who are currently underinsured. So you've heard about the mandate, that most individuals will be mandated to have insurance by January 1st, 2014. However, the government will provide tax credits to some who can't afford it. There will be some who are exempt. Individuals without access to insurance can purchase coverage through a marketplace, which we'll talk about later. The intent there is for it to be affordable and to be in large purchasing pools. Adults cannot be denied coverage for pre-existing conditions, and states can choose to cover more individuals by expanding their Medicaid programs. This slide, which you will be able to link onto, is a general overview of the healthcare law, and it actually walks you through many more of the details of the Affordable Care Act. It's about a 9-minute video. I won't go through this here, but there is a link for you to be able to click on that and watch it. It's from the Henry J. Kaiser Family Foundation. It's a reputable source, and as I said, gives a very good nonpartisan overview of the Affordable Care Act. So when we look at coverage, there's essentially, think of a 3-legged stool for insurance coverage. There is employer coverage, which the working public is generally familiar with. There are public programs such as Medicaid, the Children's Health Insurance Program, and Medicare. But then there's the new leg to the stool is the marketplace coverage, and that we're going to spend a little bit of time going through. So let's pull it into our state of Vermont. As we know, the Affordable Care Act mandated that each state be either part of a federal health exchange or create their own exchange. And what the exchange is effectively a marketplace where individuals and small businesses can go and shop for coverage. So in Vermont, how will Vermont individuals get coverage? Individuals with insurance through their employers or private insurance do not have to change their plans, but they can still go on the marketplace or the exchange and compare other options. Individuals who qualify for Medicare or Medicaid will continue to be eligible for those programs. Individuals who don't have insurance will be required, and this is the mandate, to purchase insurance in the marketplace. And we'll look in a little bit how you would go about doing that. How will the Affordable Care Act change employer-based insurance programs? It will build on and expand the employer-based insurance system instead of limiting. It will give tax incentives to small businesses for insuring their employees. And what we mean by small businesses are those businesses who employ 50 or fewer individuals. It will fine large employers for not insuring employees. And it will require very large employees to insure by providing employer-sponsored plans. So what does this mean, for example, for Vermont's small businesses? So the problem has been that small businesses haven't always been able to afford to provide health insurance to their employees. Sometimes even when insurance options are provided, they're limited and too expensive for employees to access. The Affordable Care Act makes providing insurance more affordable for many small business employers. It expands their options in some place and limits costs for their employees. How does it work for small businesses? Small businesses with fewer than 50 employees are not mandated to provide insurance coverage. Employees of small businesses may be eligible for tax credits to purchase insurance on their own in online marketplace if their employers do not provide it. So again, small businesses are not mandated to provide insurance, and their employees, simply acting as individuals, would go to the marketplace to buy their own insurance. Small businesses with fewer than 25 employees are actually eligible for tax credits if they do decide to offer health insurance to their employees. So what are the penalties for small businesses? A small business with less than 50 full-time employees, and full-time is counted as 30 hours per week, will not be penalized for not offering health insurance to their employees. Employers with more than 50 full-time equivalent employees can be penalized in two ways. If they're not offering health insurance, they'll be penalized $2,000 per employee minus their first 30 employees. Or by not offering affordable health insurance, they'll be penalized $3,000 per employee for those employees who receive tax subsidies through the health insurance marketplace. So there are some penalties that are associated with the small businesses. So how now do Vermont individuals and small businesses get coverage? This is called the marketplace. It's also called the Health Exchange, and in Vermont, it's also called Vermont Health Connect. Those three words are the same. They mean the same thing. So starting in 2014, January 1st, there will be new state-based marketplaces called Affordable Insurance Exchanges, where you'll have the choice of buying private plans. There will be tax credits to make buying insurance more affordable. This marketplace coverage, if you think back to the three-legged stool, this is key to the Affordable Care Act. Starting in January 1st, individuals and small businesses can shop in the new health insurance marketplace. This marketplace will feature standardized insurance products, tools for comparing options and finding the best plans, and strong insurer oversight. So when you go to this marketplace, you'll be able to compare plans side by side and view the options that each plan offers and the costs associated with plans. There will be no more guesswork as to what things will cost you. Each plan as well also has a list of what's called essential benefits. Every plan must include this. These are ambulatory care services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services and chronic disease management, and pediatric services including oral and vision care. So again, these are 10 essential benefits which health plans must offer. Purchasing through the marketplace, also known as the exchange. In doing this, no one can be turned down for insurance. There is a minimal rating system, and there are no medical history forms to fill out. For those individuals who are 100 to 400 times the federal poverty level, FPL, these individuals will pay between 2 and 9.5% of their income toward premium costs, so this will be income sensitive. Government will give tax credits to cover the balance of the premium, and they will determine what that is at the time of the enrollment or with your income tax filing. Smokers will have to pay the difference of their additional premiums charged without tax credit help. So there is some incentive, as you can see, for preventative health measures built into this. Policies, all policies will at least meet essential benefit packages, which we just reviewed, though other features may vary. So where is the Vermont Health Insurance Marketplace? The Vermont Health Insurance Marketplace is called Vermont Health Connect, and it's available online at healthconnect.vermont.gov. This marketplace allows Vermonters to compare coverage options between approved insurance companies that will best meet your individual and small business needs. The cost of each plan, which is the premium, and the total out-of-pocket expense that consumers must bear for each plan is clearly defined and gives individuals a choice of options for coverage and for payment. Vermont Health Connect opens today, Tuesday, October the 1st, and Vermonters will be able to go into the website to compare plans and subscribe to them. However, you won't be able to start to pay for these plans until November the 1st. Which health insurers are offering plans on the Vermont Health Connect? Currently, Blue Cross Blue Shield of Vermont and MVP Healthcare are the only two health insurers selling plans on the market. Each of these insurers will offer 9 different plans. There will be 6 standard plans created by the state and 3 choice plans created by the insurers. The 18 plans range in benefit levels, and they have a color-coded system from the bronze plans, which have low premiums and high out-of-pocket liability, all the way up to the platinum plans, which have high premiums and greater coverage. When does the health coverage take effect? Vermont Health Connect, as we said, officially opens its doors for window shopping and subscriptions today, and the administration says that Vermonters will be able to buy plans as early as November the 1st. The administration is encouraging residents to choose a plan in November and pay for it as early as possible to ensure that they have an insurance card on January the 1st. For plans to take effect by January the 1st, Vermonters buying insurance independently must pay for that coverage by December the 15th. Employees receiving all or part of their coverage from employers have until December 31st to pay. So where do I enroll? Well, there are 3 main ways to enroll in these new plans. The first way is to use the state's website for the market, which is healthconnect.vermont.gov. The second option, if you prefer, is to call one of 2 hotlines to ask questions and to enroll. Individuals can call 855-899-9600, and employers and their employees can call the small business line at 855-499-9800. In addition, in October, the state is planning to hold enrollment events. To see a calendar that lists these enrollment sessions and other public outreach events, go to the website at healthconnect.vermont.gov. It all seems a little overwhelming, so where can you get help for this change in our health insurance? In addition to the hotlines on the previous slide, you can contact what are called local health navigators. There are more than 200 people across the state working for a range of organizations who are charged with providing free one-on-one assistance to Vermonters and businesses that need help in understanding the new market. There is a list of navigators in your community and their contact information located at healthconnect.vermont.gov. In addition to navigators, you can go to insurance brokers who can also help residents and businesses choose plans. They do charge a fixed cost per month, and on January 1st, a Vermont law will make it illegal for health insurance companies to bake broker fees into their premiums. So essentially, we've reached the end of the formal presentation. I recognize it's a lot to take in, but I'd be happy to take questions if you have any.
Before we delve into those questions, we're going to do a real quick poll right here. And so again, I draw your attention to the small a in that string of 4 icons at the top of the participant box, and I would ask you to choose A, B, or C as a result of this webinar. Do you have a better understanding of Vermont's new healthcare coverage? A, yes. B, it hasn't added much, and C, no. And about 5 more seconds to choose A, B, or C, please. Okay, the next question. Did the webinar give you new resources on navigating Vermont's new healthcare coverage? Again, the choices are A, B, or C. And our final poll question is, as a result of what you learned, will you use this information or share it with others? Again, the choices are A, B, and C. Great. Okay, and we're going to start out with questions. We had one from Gail. If you have questions, I would invite you to type those in the chat box. Also, those of you who may have joined after we started the program, we'd like to have you enter your email into the chat box so we know who joined us today. And the first question that Gail offered up was, there's a large Mennonite population in Vermont. They don't have health insurance for religious reasons. Are they therefore exempt?
They may be exempt, and the difficulty with the application of the federal law is that it also has to take into account federal exemptions. So there may be exemptions possible for religious groups based on religious reasons. But again, they have to be recognized religious groups. So although I can't answer that definitively, that would be a question that a navigator could answer. But yes, there would be the possibility of exemption.
Great, thanks, Karen. Are there other questions? Please feel free to type those in the chat box. Karen's with us for a few more minutes, and she'd love to answer any questions you might have.
I would also say, while you're thinking of questions, I did try several times to go on to the Vermont Health Connect website today, and as you can imagine, I think the website has been a little overwhelmed. So if you don't get through, if you're just curious, you can go through and try again maybe later this afternoon or tomorrow sometime. I think there's going to be a lot of novelty in just going in to see what it is. But the website is very comprehensive, and you can simply walk through it without committing any information to it if you're curious about what's on the the Vermont Connect website.
Great, thanks. And we have another question here. Is depreciation allowed in figuring the adjusted income amount to qualify for help with the premium or deductibles?
And are you talking about business or for businesses?
For farmers.
For farmers. That I do not have the answer to. They will, on the website, you will go in and actually be able to enter what values you have into the website, and it will do the calculation for you. And it will be able to tell you what you're allowed to take as a depreciation.
Thanks. Other questions? Please feel free to type those in the chat box. And a big thank you for that last response and answer to their question, Karen.
You're welcome.
Oh,
I should
no,
say
go ahead.
too. Oh, go ahead. I was just going to say, part of what makes this approach so difficult, but what ultimately should be a great benefit, is the fact that many of these factors are going to be highly individual. So in going through the Vermont Health Connect site, you will be able to go in and put in, number of family members or business information or income information. And so what you end up with then is this titration of factors that's particular to your situation that will give you the best care for the best price. So if it sounds like I can't answer a lot of specific questions, that's part of the reason why.
And we have a question. Is this strictly for legal residents?
It is. The Affordable Health Care Act is for legal residents. However, if businesses want to provide health care, policies, premiums, there may be the option to do that. However, individuals should be documented residents of the United States. But as it stands overall, it's for legal U.S. residents.
Thanks.
And of course, what goes hand in hand with the Affordable Care Act, many people would argue, would be immigration reform. So, but that's a whole other webinar.
Great, thank you. Other questions? Feel free to type those in the chat box. And while you're thinking of those and typing, I just remind you that this is being recorded and it will be available on our website, our Building Capacity website. And you can also friend us on Facebook. We do offer lots of things there, including updates and links to our upcoming webinars. You can also email us at capacity@uvm.edu. And the next webinar that we will offer is on the first Tuesday of the month again, and that will be November the 5th. And our topic will be improving the team's performance. So this is from our team leadership module. And if you can join us then, we'd love to have you. And I'm looking for more questions, and I'm not seeing them. So I guess we will conclude for today, and thank you again for participating. And thank you, Karen.
Thank you all very much. Feel free to email me at karen.geraghty@uvm.edu. If you have other questions, I can perhaps try and find resources for you. Thank you.